And thank you all so much for the opportunity to talk with you a little bit today about Social Security Administration's Compassionate Allowances Initiative. Again, for anyone who may have missed it, my name is Peter Smith, and I'm a Disability Policy Analyst with SSA's Office of Compassionate Allowances and Disability Outreach. I've been with the agency for a little under 3 years, and I've spent the majority of that time with the Compassionate Allowances Initiative. I'm also joined here by Jamila Jackson, who is the Deputy Director of the Office of Compassionate Allowances and Disability Outreach. So I want to begin real quick by giving just a real brief outline of what I want to cover this afternoon in this webinar. So first, I'd like to talk just very broadly, as Elizabeth mentioned, about Social Security's 2 disability programs, the 2 programs that we operate here at the agency. And then following that, I want to go into a little bit more detail about the Compassionate Allowances Initiative itself and really how it fits into the 2 disability programs that we have here at SSA. So I don't really anticipate that this will take really much more than maybe 25 or 30 minutes. So after I finish speaking, we should have more than plenty time to address any questions that you have for me. And when we reach that question stage, I guess I'll turn it back over to Elizabeth, and she can once again just give a reminder about how to go about asking questions. So just to kick it off, let's begin by talking about SSA's 2 disability programs. So the Social Security Administration, which you'll also hear me refer interchangeably to as SSA, administers 2 distinct disability programs under the Social Security Act. The first of these programs is the Social Security Disability Insurance Program, which we also call SSDI, although you may commonly hear this referred to simply as Social Security Disability. The second program is Supplemental Security Income Program, which is most commonly called SSI. So just to recap, there are 2 disability programs. There's SSDI and SSI. So let's start with a quick overview of each one, starting with SSDI. SSDI pays benefits to disabled individuals who are insured under the SSDI program. What this means is that these are individuals who have paid Social Security taxes over a required period of time. The SSDI program is financed with Social Security taxes that are paid by workers and employers based on each worker's earnings. So if you take a look at your paycheck, you'll notice a section for FICA taxes. And FICA stands for the Federal Insurance Contributions Act. And FICA is how contributions to the social insurance system are collected. Under SSDI, monthly disability benefits are based on a worker's lifetime average earnings. There's a mandatory 5-month waiting period after disability insurance benefits are awarded before payments are issued. Also, beneficiaries under SSDI are eligible for Medicare after 2 years. The SSI program differs from the SSDI program in that SSI is a means-tested program or a needs-based program, right? So SSI is available to adults with limited income and financial resources. And in addition to these financial restrictions, SSI beneficiaries must also be age 65 or older, or they must be disabled or blind. And SSI is also available to disabled children from birth to age 18. Unlike SSDI, there is no waiting period for SSI. So as soon as you're eligible for benefits, you start receiving your benefits check. And SSI recipients are also automatically made eligible for Medicaid. Now, in order to receive benefits under either the SSDI or the SSI disability programs, an individual must meet SSA's definition of disability. So how do we define disability? At SSA, we consider you disabled under Social Security rules if you have a medical condition, and due to that medical condition, you cannot do any of the work that you did before you were disabled, and we also determine that you cannot adjust to any other work as a result of your medical condition. We also require that your disability is expected to last or has lasted for at least 1 year, or that your disability will result in death. And please bear in mind that SSA does not pay partial or short-term disability benefits. So recipients of SSA's disability benefits may be entitled to access to Medicare or Medicaid as well. Everyone who is eligible for SSDI benefits is also eligible for Medicare coverage. Enrollment in Medicare is automatic after 24 months of entitlement to disability benefits. The Medicare program is administered by the Centers for Medicare and Medicaid Services, which is a federal agency that is independent of the Social Security Administration. But if you have more questions or want more information on Medicare, you can find more information by visiting the program's website or by calling 1-800-MEDICARE. Likewise, beneficiaries of Social Security's SSI program may also be eligible to receive Medicaid. In most states, the eligibility requirements for Medicaid actually mirror the requirements for SSI, and in fact, in many states, the application for SSI also doubles as an application for Medicaid. So in those states, once you apply for SSI, you're also applying for Medicaid. And although Medicaid is jointly funded by the federal government and the individual states, it's important to note that the program is actually administered at the state level. So each state has its own rules about who is eligible and its own rules about what is covered under Medicaid. So for really detailed information about the Medicaid program in terms of the eligibility requirements and what it covers, the best source of information is actually your local state office. Okay, so now that we've briefly introduced SSA's 2 disability programs, and hopefully at this point you're a bit more familiar with those 2 programs, let's delve in a little more deeply into the Compassionate Allowances Initiative. Compassionate Allowances, which we also here at the agency call CAL, are a way of quickly identifying diseases and other medical conditions that invariably qualify under SSA's listing of impairments based on minimum objective medical information. In other words, CAL conditions are those that are so severe that proof of the diagnosis is enough to make the disability determination. Compassionate allowances allow Social Security to quickly target the most obviously disabled individuals for allowances. It's a fast-track program. In other words, it moves individuals to the head of the line so that they can receive a decision on their disability claim sooner than perhaps they likely would otherwise. So just to be clear, CAL is not a separate program from SSDI or SSI. Rather, it's a means to expedite a decision within those 2 programs. So with this in mind, CAL does not change the amount of benefits to which an individual is entitled. It does not change access to Medicare or Medicaid, and it does not change the mandatory waiting periods that exist under those programs. The CAL initiative began in October 2008 with just 50 conditions, which included 25 cancers and 25 rare diseases. And since then, we've added 63 conditions to the Compassionate Allowances list, with another 52 conditions coming in August of this year, so just in a few months. And at the end of August, we will have brought the grand total to 165 CAL conditions. So how conditions are actually selected for inclusion to the list of compassionate allowances is really an important piece to understanding the initiative. So with that in mind, how do we choose which conditions become compassionate allowances? Well, we solicit input from a number of sources. We gather information from our many public outreach hearings. We work with advocacy groups. We solicit comments from the Social Security and disability determination communities. And these are the folks who deal with claimants really on a day-to-day basis. We talk with medical and scientific experts from around the country, and we collaborate on research with the National Institutes of Health. It really takes quite a few months to gather all the information from all of these sources that we need to make a final determination as to whether a condition will or will not be added to the list of compassionate allowances. And in addition to all the information gathering, we also have to prepare our computer systems in order to be able to successfully identify conditions when individuals apply for benefits. So again, one of the approaches that we use to gather information on potential CAL conditions is to conduct public outreach hearings. And since CAL's inception in 2007, we've held 7 public outreach hearings throughout the country. And with each of these hearings, each one has been co-hosted by the National Institutes of Health. And the objective of these hearings is to obtain medical and scientific information about potential CAL conditions. But there's also the added bonus and benefit that it provides a forum for individuals living with the illnesses and their families to share their experiences with the agency. NIH, or the National Institutes of Health, has played a pretty integral role in helping us advance the CAL initiative, and several of the institutes have participated in our CAL hearings. We also have a memorandum of understanding through which NIH helps SSa ensure that when we do select CAL conditions, that we're doing so based on sound and up-to-date medical standards and science. And in addition to our memorandum of understanding, we also actually have a funded interagency agreement with NIH's Clinical Research Center to leverage our data and combine it with current research regarding functional ability. Additional information about our hearings, including the actual archived webcasts of the hearings. So if you are interested in going out and watching any of the 7 hearings, you can do so at our website, which is www.socialsecurity.gov/compassionate-allowances. And I'll put that web address up on the final slide, so don't worry about it if you didn't catch it at this moment. It'll be visible later in the presentation. So in addition to the public outreach hearings, we also work really closely with a number of advocacy groups. What you see here is a list of the number of groups that we work with. The advocacy groups have been extremely supportive, really, of our efforts to improve our disability process. We receive numerous recommendations from advocacy groups for new CAL conditions. There really is no magical formula for selecting a condition to be added to the list. Our staff makes recommendations for new conditions after reviewing all the information that we've received, including analysis and recommendations from our own medical staff that is internal to SSa. But generally, we consider which conditions are most likely to meet our current definition of disability. But we also require that our computer systems be able to identify the CAL condition based upon the claimant's allegation. So there's certainly a medical component to the decision to add a new CAL condition, but there's also this technical piece that accounts for limitations in our computer system to identify conditions just based on a claimant's allegation. So both of those requirements need to be met when we do end up adding a new condition to the CAL list. And since I've just brought up the claimant's allegation, let's talk for a moment about how an individual can actually go ahead and apply for disability benefits. So there are 2 ways to apply for benefits. The first is to apply online. And you can do this by visiting our website at www.socialsecurity.gov. And then what you'll want to do is select the Apply Online for Disability Benefits link, which is located on the left-hand side under the Top Services heading. The second way is to apply in person at one of our field offices, which we have field offices located across the country. And you can schedule an appointment for an in-person visit to the field office by either visiting the field office or calling our toll-free number, which is 1-800-772-1213. You can also call this toll-free number for answers to any other questions you may have regarding filing a claim. So what you see here is a quick rundown of some of the information that we will ask you during the application process. We'll ask you to tell us about your condition. We'll ask you about any treatment you've received for your condition, any medications that you're taking, your educational background, your past work history, and we'll ask you to provide us with permission to request your medical records from your doctors. So now that the claimant has filed an application, what happens next? What are the next steps? The application is forwarded for evaluation to the State Disability Determination Services Agency, or DDS. The DDS are agencies that are run by each state that make disability findings on behalf of SSA. So upon receipt in the DDS of the claim, the case is assigned to a disability examiner. And the examiner reviews the evidence and consults with staff physicians and staff psychologists. They contact the claimant's medical sources and review the claimant's statement of daily activities, which is the claimant's account of what they can and cannot do on a daily basis. In addition, we may request a consultative examination of the claimant if it's determined that we need more information to make a determination. So after all of that information is gathered, the DDS will make the initial disability decision on the claim. In making the disability determination, the adjudicator will walk through a 5-step evaluation process, and it's the 5 steps that you see before you. So first, the adjudicator will ask, is there substantial gainful activity? What we mean by this, substantial gainful activity, is really the agency's way of asking, is the claimant working? Generally, if you are working and you are earning more than $1,010 per month, and that's the number that we've set for as of January 2012. So if you are working and you're earning above that income threshold, generally we will not find you disabled. If you're not working, or you are working and you're earning below that substantial gainful activity threshold, the adjudicator will then ask, is the impairment severe? And does the impairment meet or equal one of SSA's medical listings? The adjudicator will also ask, can the claimant perform any of their past relevant work? In other words, any of the work that they've completed or that they performed before their disability? And also, can the claimant perform any other type of work in addition to the work that they performed prior to their disability? Is there anything new that they can adapt to? So these are the 5 steps that adjudicators use to evaluate their decision for disability. Now, it's important to note that it's not always necessary really to go through all 5 steps to render a decision. In many cases, and this is the case with CAL cases, for example, cases can be adjudicated earlier in the process. It's not necessary to go through each of those 5 steps in order to render a final decision. Okay, so this slide shows the path that a claim takes when it is identified as a CAL case, beginning with the claimant alleging a condition on the CAL list, to the software identifying the CAL condition, to the impairment summaries that the adjudicators may use as a guide when making their decision. So this is how CAL cases are processed and identified. Once it is determined that the individual has alleged a CAL condition and the agency has received objective medical evidence that supports that allegation, our adjudicators can quickly make a decision on the claim. And although the processing times for claims vary from case to case, a typical CAL case can be adjudicated in a matter of weeks versus perhaps a matter of months or years for non-fast track cases. So as of August 2011, we've actually reduced the burden on claimants with CAL conditions by allowing them to bypass questions relating to their vocational and educational histories. You may remember this as step 4 and step 5 on the previous slide on the decision-making process. So with CAL cases, when claimants come in and apply, we don't actually ask questions related to those areas. However, we still do ask claimants if they are currently working. So let's take a quick look at one of our impairment summaries. And these impairment summaries are what adjudicators may use to guide their decisions. So the one that is there before you is the impairment summary for malignant multiple sclerosis, which is a CAL condition that was added to the list last December. The impairment summaries serve sort of as a cheat sheet to assist adjudicators in making their disability determinations. And there's one of these impairment summaries for every single one of the CAL conditions. And likewise for all the new CAL conditions that we will add moving forward, we'll have impairment summaries for those as well. The impairment summaries provide alternate names for the condition. So although when you look at the official published list of compassionate allowances, for this case, for this condition, for example, it will say malignant multiple sclerosis. A claimant may actually allege any of the alternate names that are listed in the impairment summary, and our software will pick it up. So our software will identify the claim as a CAL condition if the claimant uses any of the alternate names that are shown in that impairment summary. The impairment summary also provides a description of the condition. It provides any diagnostic testing and physical findings that the adjudicator should look for in the medical evidence. It provides treatment of the condition, information about progression of the condition, and the suggested medical listing that the adjudicator may want to use in making his or her determination. So essentially, it provides information that the adjudicator may find helpful in making the disability determination. Adjudicators may, at their discretion, use the medical evidence of record and listings suggested to evaluate the claim. And when I refer to the listings, it just means our legal guidance or rules that govern disability. But it's important to remember that the actual decision to allow or deny a claim ultimately does rest with the adjudicator. Okay, so we've almost reached the end, but before we get there, I want to talk just real briefly about the Compassionate Allowances Initiative moving forward. So it's no secret that the federal government is under some budget restraints, and this does not spare the Social Security Administration. So consequently, at this time, we're not planning any CAL outreach hearings for the near future. We will, however, continue to reach out to advocacy organizations to offer video and teleconferences. We'll also continue to participate in webinars such as this one, as well as in conferences that are in the Baltimore, Washington area to share information about CAL. Following the webinar, please feel free to submit any comments or suggestions you may have about the CAL initiative or potential conditions to our mailbox. Our mailbox address is compassionate.allowances@ssa.gov. Again, that's compassionate.allowances@ssa.gov. Okay, now the final thing I want to do is just show you the list of compassionate allowances conditions. This slide and the two that follow includes the entire list of CALs, And the conditions that will be new as of this August are colored in red. So I'll just click through the slides slowly so you can see really just the number and variety of conditions that are present on our list of compassionate allowances. As you can see, we will reach number 165 by August of this year, and this is really a major accomplishment for our team. But for a closer look, because I know it's probably impossible to get all of them down in the time I just allowed you, but for a closer look into the full list, you can access the list of compassionate allowances through our website. So this actually concludes the slide presentation. So thank you again so much for your time and your interest in the Compassionate Allowances Initiative. The presentation I'll make available to anyone who's interested in receiving a copy. Just shoot an email over to the Compassionate Allowances mailbox and we'll forward you a copy of it. But for now, I guess I'll turn the stage back over to Elizabeth, who can explain once again how the process for posing any questions you may have. Now bear in mind that we are experts on compassionate allowances, but Social Security oversees a pretty broad swath of programs. So we're not experts on every program that SSA administers. Nevertheless, I will do my best to answer all of your CAL and non-CAL related questions. And any questions that we can't answer today, we will get you answers to you through NeedyMeds. So that concludes the slide portion, so I'll turn it over to Elizabeth. Thank you.
All right, thank you very much, Peter. That was very informative. We did get a lot of questions about copies of the presentation, so Peter was saying you can email that General Compassionate Allowances email to get a copy of the slides. So again, you can type in questions into that questions bar on your control panel, and then we'll just go through them and answer them in the order that they come in. So I'm just going to start reading some questions out loud, and Peter will hopefully be able to get to all of them. First one, I think this would come towards the middle of the presentation. What was the amount for the monthly gainful activity?
Sure. So the threshold for substantial gainful activity, as it stands right now, is $1,010 per month. Traditionally, the practice is that SSA will adjust that number yearly. But as of 2012 and for the foreseeable future, that number again is $1,010 per month.
Okay. Okay, so there was a question that says, when you do allocated temporary benefits to clients, do you use CAL to allocate temporary SSI or SSDI?
So the Social Security Administration does not provide short-term or temporary benefits. What I can say is generally with the benefits that we do offer, CAL, again, is a process for expediting claims within the SSDI and SSi benefit programs. So whether you have a CAL condition or not a CAL condition, the amount of benefits, the manner in which you receive the benefits, all of that does not change from the standard SSDI or SSi programs. So again, CAL is just a manner of taking your claim and sort of moving it to the front of the line because the condition that you have is so severe or so obviously meets our standards that we're able to quickly identify it. Okay.
So I think you sort of already answered this. There's a question about doing presentations for local groups. So you said that you can do them, you know, in the DC, Baltimore area, and then you're able to do these webinars as well. Is that correct?
Yeah, I think that's a fair statement. You know, unfortunately, we don't have the capability to travel as much as we'd like, but we are definitely open to doing webinars for any groups that are interested. So I think the way that you at NeedyMeds have structured this, I think is perfect. I think it works very well. So we'd be very interested in doing anything along those lines. And also, within the Baltimore, Washington area were also available for in-person presentations, I guess.
Okay.
So I guess if you do have an interest in having SSA or having our office present similar to this manner, I would recommend shooting an email over to our mailbox and making that request, and then we can work from there.
Okay, we have a question from a patient advocate. Once an application is turned in by a claimant, but prior to a determination being made, can a claimant allege that they have a CAL condition? This advocate has found that some patients have recently applied for SSI or SSDI, have a CAL condition, but do not indicate it. It is appropriate for them to then call the SSA office. You got all that, Peter?
I think so. So I think
okay.
I'll answer that question as best as I can. So when the claimant alleges or files their application for disability benefits, the claimant is not alleging, I have a CAL condition. The claimant will allege the condition they actually have. So in the example that I used with malignant multiple sclerosis, the claimant would not say, the claimant would allege, I have malignant multiple sclerosis. They would not allege, I have a CAL condition. It's once they allege malignant multiple sclerosis or any other CAL condition that our software or our field office reps will
DDS examiners.
Sorry, I've been corrected. DDS examiners will flag it as a CAL condition, and then it goes through the process there. So it's not necessary that the claimants have marked that they have a CAL condition or even be aware that they have a CAL condition. If they make the allegation that they have a CAL condition, their claim will move through the process as though they do. Okay,
I think this next question may have already been answered then. Someone's relative has renal failure, and they're wondering what kind of assistance that he may receive. So it'll just be, that'll probably be picked up automatically, you're saying?
I'm sorry, renal, this is Jamila Jackson, the Deputy Director for Office of Compassionate Allowances and Disability Outreach. End-stage renal disease is not currently a CAL condition.
Okay. So, okay, and the next question we have is, can you give a brief overview of how someone who comes to the United States with no work history qualifies for SSI?
That is a good question, and I'm not sure that I have a definitive answer on that.
We will take that down, and if you wouldn't mind, Elizabeth, we could send that information to you once we get more concrete information about that. So is the person a citizen?
You know what, I'm not sure, but what I'll do is I'll just write down this person's name, and if you want to send me that, I can send it to them.
Okay.
Perfect, thank you.
Okay. Let's see. It says, is it correct that the CAL diagnosis process can take several weeks versus several months or years compared to other diagnoses?
So I think maybe what the question is asking is does when a claimant alleges a CAL condition, typically does the disability determination process last a few weeks as opposed to months?
I think that is the question, just the timeline.
And I think that's a fair statement to make. I think that is accurate. And again, the disability process for each claim, it varies. So I'm hesitant to say that it takes 1 week versus 2 weeks versus 3 weeks. But generally, I think it's accurate to say that CAL cases, because they're fast-tracked, typically are adjudicated in a matter of weeks as opposed to months or years.
Okay.
Elizabeth?
Mm-hmm.
Also, it depends on when the medical evidence has been provided by the claimant as well, how quickly the claim can be, a decision can be made on the claim.
Okay. There's a question about submitting a request for a disease group get added to CAL, and they would just go ahead and email that general compassionate allowances to get started email address.
Yeah, so if for any groups out there that are interested in recommending a condition for inclusion on the list of compassionate allowances, what I would recommend doing is sending an email to our mailbox and including any information that you think would be relevant, including a lot of, actually a good suggestion I think would be to look at the impairment summaries and to the best that you're able to do, send us the information that would be found in the impairment summaries. So we do look for advocacy groups and help from other organizations to kind of get all the information, gather all the information we need in order to making that decision of inclusion or not. And so the more information that any groups can send us, I think the better. So we welcome it.
Okay, there's a question again for how to obtain slides. Do you want to go back to that email address, maybe the general email address I can get in touch with you for?
Sure. Yes, I will. I'll put it up real quick.
Okay. Okay, it looks like you've already answered some of these questions. So it's just a question about expediting an application for a disease group that's not already on CAL. Is there any way to expedite that, or just go ahead and submit the application normally?
We do have other expedite processes. We have the terminal illness process. If a claimant has a terminal illness, they also will receive a quicker decision on their claim. And evidence about that terminal illness will come from the medical evidence provided, if they're in hospice care, if they've been diagnosed with a disease like AIDS or something like that. But we do have other processes for individuals who have conditions that aren't on the CAL list. In addition to the terminal illness process, we also have presumptive disability, which is only in the SSi program, where we will provide temporary benefits while we're making the decision on your claim if you meet certain criteria for presumptive disability. We also have an expedited process for individuals who have served in the military during Desert Storm, Iraqi wars. And if you have medical evidence that supports that you've been injured during the course of your military service, we have an expedited process for that as well. And then we also have a quick disability determination process, which is an electronic process like the Compassionate Allowances Initiative. And what that process does is it uses a statistical model that looks at various information provided in the application to determine whether the case is a case that can be quickly decided that will result in an allowance. So we have several other processes besides the Compassionate Allowances Initiative for expediting your claim if you meet certain criteria.
Okay, thank you. There's a question about what type of medical evidence a claimant should turn in with the application, for example, pathology reports, letters from doctors, etc.
So really, I think the general rule here is probably the more the better.
Right.
Anything that is relevant
to your condition that you're alleging. So it would include pathology reports. It would include information about the medications you're taking, the prognosis, the progression of the disease, any treatment that you receive from your doctors, those types of information.
Okay, so we have a specific SSi question, so we're not sure you'll be able to answer this, but we'll give it a try. I think Peter said at one point that once a person is approved for SSi, they will receive their check upon approval, but when SSDI is approved, how long does it take for the recipient to receive their first check?
Okay, so with SSDI, there is a 5-month waiting period, and that waiting period begins when the agency has determined that the disability began.
When the disability began.
Right. So if, for example, if in the case of SSDI, the disability began in January of 2012, but you waited until June of 2012 to apply for benefits, the 5-month waiting period would have commenced in January.
If we determined that you were disabled back to January.
Right, exactly. However, if you applied in January and we determined that the disability began in January, there would be a 5-month waiting period before you received your first benefits check. So it would not, you wouldn't receive your first benefits check until May of 2012. With SSI, on the other hand, there is no waiting period.
Right, but it's not that we provide you a paper check as soon as you receive a letter saying that you're allowed. You know, there still is a month's time while we work to get our computer systems ready to send you that benefit information. But certainly SSI, with that program, you do receive your benefits quicker due to the fact that there's no waiting period.
Another timeline question: if someone's denied SSI due to an error in the application, how long will reconsideration take?
Generally speaking, if you appeal a decision on your claim to the reconsideration level, it could take, anywhere from 3 to 6 months to receive a new decision on your reconsideration request. But that's generally speaking.
Okay. There's a question. Can you comment on whether having a lawyer involved with a non-CAL condition helps to speed up the process?
Elizabeth, while we don't advocate that people obtain attorneys for applying or receiving disability benefits, we do not discourage people from using an attorney and to assist them with receiving their disability benefits. But we certainly, it's not a requirement that people obtain an attorney in order to receive disability benefits.
Okay. Are there any other questions? I think we've mostly covered them. You should all have my email address. I sent you that reminder email. So I can just say that out loud, just in case, we didn't get into any questions and you have more questions, you can email me and I can get you to Peter and Jamila, or you can email this email address up on the screen. But if you did just have any more questions or any questions about NeedyMeds, I'll just say quickly out loud that my email address is just elizabeth@needymeds.org. So that's just elizabeth@needymeds.org. So we did get another question while I was saying that, and it's how long does it take to process a non-CAL application? On non-CAL applications?
It really depends on our workload. Due to the recession, we've received a larger number of individuals applying for our benefits. And I think in Peter's slides, he showed that in 2007, we received a little over 2 million claims. In 2011, we received over 3 million claims. And so just recognizing that there is a large number of people applying every day, and we're doing certainly the best that we can. I can't say specifically how long it will take, but we are working on making it quicker all the time. And so with the Compassionate Allowances Initiative and our other expedited processes, that helps us with that.
There's a question about whether a stroke is currently listed as a CAL.
Stroke is not currently listed as a CAL condition, no.
Okay, there's still a question about whether using a lawyer will expedite the application, but I'm kind of guessing you both just sort of say, you can if you want to, but it's not something you recommend one way or the other.
Right, yeah, we don't discourage people from obtaining attorneys, but it's not a requirement for getting disability benefits. It's really about whether you meet the non-disability requirements of either the Social Security Disability Insurance Program or the SSI program. Some of the non-disability requirements Peter mentioned, such as the earnings. For SSI, it's the income and resources. And then also, secondly, that your medical evidence supports that you meet our definition of disability. Are you able to work? Is your condition severe? Can you do your current work can you do other work? These are the types of criteria that's needed to make a decision on a claim. So an attorney may help you in gathering your medical evidence, but also SSA is available via our 800 number to answer any questions that claimants might have in that regard.
Okay. Doesn't look like we have any more questions. I mean, I encourage everyone to email the Compassionate Allowances general email if you do have any more that we didn't get to or didn't answer completely. But in the meantime, we really appreciate NeedyMeds, Peter and Jamila being with us and hosting this webinar. We hope that it was helpful for everyone and that everyone has a good afternoon. And
Beth, if I could just ask one question. Is the webinar that we did today, is that going to be posted on your website?
We are recording it. We are currently kind of working on getting recordings available for our webinars, so not immediately. So I would definitely encourage those that just want the slides to email you, and I can sort of keep you updated on that. But we're hopefully trying to make recordings available soon.
Okay.
Okay, so again, go ahead. If we didn't get to your questions, email the Compassionate Allowances, or you can reach out to me and I'll get you in touch with them. And I hope everyone has a good afternoon.
Thank you, Elizabeth.
Thank you, Elizabeth.
Thank you. Bye-bye.